This is a quick overview slide presentation related to the future of healthcare, and particularly as it relates to serving older adults. What's happening in the world? We know the world is, of course, getting much older, and it's happening very quickly, and it's happening in countries all over the world. And we know that as people get older, there are more and more healthcare needs. This means that among many other areas, certainly healthcare delivery and costs is a future area of focus, both in our country and around the world. We just passed healthcare reform legislation. It seems like it was quite a bit of compromise, and unfortunately, oftentimes with compromise, you don't get very good solutions. And so many of the issues still facing older adults and small businesses still exist. For small businesses that are that serve older adults, they tend to employ a lot of frontline caregivers and have great difficulty sometimes covering the cost of healthcare benefits in low margin businesses such as non-medical home care services. And so it's increasingly difficult for small businesses to cover healthcare costs for their employees. What does that mean for employees? It means that people are spending more and more of their household income on healthcare costs, which creates even greater burdens. So related to older adults, in our healthcare system, the primary problem areas right now, the biggest one is probably fragmentation of care, meaning that the left hand doesn't know what the right hand is doing. And so records aren't shared readily, and people don't have the information they need to make good decisions. Second issue is that we don't have very good support systems for people to be active participants in managing their own health care. And a third issue is that we just don't have very many people interested in serving older adults at this point in the healthcare profession and in other professions as well. And this is despite the baby boomers coming down the pike, which means these needs are going to multiply exponentially. This is just a quote that basically emphasizes the point that most people prefer to live at home, and most people, because of that, will have to find some way to get their healthcare needs met at home. When people think about boomers, we think about people living longer and healthier, but unfortunately the reality remains that the baby boomer generation is on track to have enormous health issues and concerns as they get older. Certainly obesity, high blood pressure, and diabetes are three of the big ones. So trying to control the costs of healthcare gets pretty complicated, and the impact of that is that people make choices to not take care of themselves because of the cost of healthcare, and unfortunately this ultimately leads to greater costs. Right now, the hospitals around our nation have been mandated to lower their readmission rates, lower the incidence of admissions through emergency rooms, to offer greater end-of-life care, and really to support home monitoring and feedback. What this means is that healthcare is moving more and more into the community and out of hospitals and medical clinics. As you see on this slide here, that's sort of a map of what it might look like. PHR stands for Personal Health Record, and probably healthcare of the future is going to be some mix of information from a hospital, medical clinic, primary care physician, information from a community-based support system, and collaboration and sharing of that information across settings. This will, in fact, be the style of how to best manage chronic disease, which, as I mentioned earlier, will continue to be a big issue for people. Most chronic disease management models today are models that support early intervention in home or community-based settings. Early intervention requires somebody to be the point person so that when we start to get information about changes in condition, there's somebody there to drive a response. And so there's this whole new movement, this whole new profession of care coaches. And in fact, professional care managers often play that role as well. One of the things that we do know is Alzheimer's disease is a huge issue in our country and many countries around the world, and it's getting worse, not better, which means there are going to be more and more people with healthcare needs that will want to be served in private home settings, and so we need to build some sort of structure, system, business model that serves those adults where they want to be served. So how are we going to do this? One avenue is technology. Right now, the technology marketplace is estimated to be at about $2 billion, and it's predicted to grow to $20 billion by the year 2020. The VA recently requested $125 billion for their healthcare budget, and they would like to spend $163 million to implement a telehealth system. Telehealth systems and sensor systems, as depicted in this slide, are a way to create connections between a traditional medical system and community-based living. All of this depends on having electronic records, some agreed upon system where people can access their healthcare records in a timely way, and everybody that's involved in treatment or support will have access to the same information. So we see home health agencies, home care agencies, other kinds of support services adopting more and more technologies. That's what these graphs are about. And people are reporting using, if not using technology systems now, looking at implementing new technology systems as they interact with older adults. Not only are we looking at healthcare from a disease model, but also from a health and wellness model, safety security model, really a more of a holistic model of healthcare. And that's where health coaches, wellness coaches, whatever you call them, can drive a more holistic view of healthcare in a private community setting. And so that healthy aging involves all of the factors seen here in this diagram. And what we do know is that includes paying attention to how somebody's feeling, what they're thinking, how engaged they are, because we know the more positive somebody feels, the more upbeat they feel in life, the less likely they are to develop illness and, in fact, to be injured as well. So, food for thought. Meeting the future effectively is ultimately about a willingness to meet the demands of the reality. And reality right now says we have a whole lot of people to serve. We don't really know how we're going to serve them. We don't know how we're going to pay for services, but that means that we need new models, new coaches, new approaches to delivering early intervention and broad-based wellness support to people in community settings. In order to do that, it's important to ask these questions. Can we be open to new ways of doing things, and do we understand what we're best at and how we can improve? Because as we know, the real voyage of discovery consists not in seeking new lands, but in seeing with new eyes.